At the beginning of the epidemic, the mortality rate of infection with the new coronavirus was as high as about 2%. In order to avoid the loss of population, China adopted measures such as strict city closures, flow tracking, nucleic acid testing, and shelter isolation, and achieved results. The epidemic was quickly brought under control and the economy recovered quickly. China has become a model for the global fight against the epidemic. During that time, China sent medical teams to many countries, including some Western countries, to convey the experience and models of epidemic prevention. In June 2020, the Chinese government also released an anti-epidemic white paper to the international community, publicly expressing its intention to explain China's anti-epidemic propositions and provide Chinese solutions to the international community. Today, the global epidemic has spent 3 full years. The United States and other Western countries have reopened when the epidemic has entered the stage of Omicron virus transmission. Although countries have paid a price for this with varying numbers of deaths, people's life and economic activities have returned to the state before the epidemic. China is one of the very few countries in the world that is still under strict prevention and control. It may be the only country that is really under lockdown except North Korea. Although its death toll is pitifully small compared to China's population. However, all kinds of secondary disasters derived from the prevention and control of the epidemic have caused pressure and psychological trauma to people's lives and work, as well as destructive effects on the economy. Its overall cost far exceeds the total benefit of maintaining a dynamic zeroing policy. In the early morning of September 18, 2022, a serious traffic accident occurred in Guizhou. A bus rolled over on the highway in the early morning, causing 27 deaths and 20 injuries. At the press conference, officials notified the details of the traffic accident. The passenger car involved in the accident was a requisitioned vehicle for anti-epidemic transfers. The car was carrying 47 people, 49 people were allowed to take. Except for one driver and one staff member, the remaining 45 people are all residents involved in the epidemic. It is speculated that the cause of the accident was due to the driver's fatigue driving, because the accident happened in the early morning, which is the time when people are most likely to feel sleepy. On November 24, 2022, a fire broke out in a high-rise residential building in Jixiangyuan Community, Qianshan District, Urumqi, China, killing 10 people. The residential building involved is in a low-risk area, and there are certain restrictions on access. Netizens believe that the epidemic has delayed the escape of residents. Earlier, in January 2022, a pregnant woman was unable to be admitted to Xi'an High-Tech Hospital due to nucleic acid problems, which eventually caused the pregnant woman to miscarry. The listed company behind the hospital involved was required to suspend business for 3 months for rectification. The incident caused 2 large private hospitals to close down, and the listed company triggered other risk warnings on the stocks of listed companies. There are still many cases of casualties that have not been reported, and it is rumored that they have a certain connection with the epidemic. In the second stage, the death toll caused by the secondary incidents brought about by the epidemic prevention and control even exceeded the direct death toll caused by the epidemic, which disgusted and puzzled the public. There are also unemployed people who cannot be counted. A large number of businesses and factories have closed down, and huge financial expenditures for prevention have made many local governments miserable. Since 2022, several large-scale outbreaks of the epidemic have occurred in China. First, there was an outbreak in Beis, Guangxi, then Shenzhen and Shanghai were closed down, and then an outbreak in Hainan in August caused 80,000 tourists from Sonya to stay there, and then the epidemic reached Chengdu. Epidemics come and go and seem to never end. Now, Guangzhou is at stake. A partial blockade has begun, and large-scale protests and conflicts have broken out. A large number of people can no longer bear the impact of preventing the epidemic on their lives and work, and they are dissatisfied with the government. However, there is no voice channel on the internet, and many protest speeches and videos have been ruthlessly blocked by internet platforms. Why does the Chinese government insist on controlling the epidemic? At the beginning of the epidemic, in view of the effectiveness of the vaccine, the large elderly population, insufficient public health resources, and the lack of corresponding antiviral drugs, the Chinese government adopted a blockade and clearing approach at the first stage. In the second stage, because the death rate has dropped, most countries have liberalized control, but China has not. Some people say that the reason for not letting go of control is because the early results of the fight against the epidemic have become a political burden for the ruling party, and the early success has saved many deaths. And if you choose to lie down now, the previous achievements in the fight against the epidemic will be destroyed. Others say it is because the decision-makers are generally elderly, and if the epidemic control is relaxed, they will face a huge risk of infection and death. Some people even believe that some officials can profit from nucleic acid testing. But the fundamental reason is that China is essentially a socialist country, not a purely capitalist country. In this country, people's lives are always more important than economic development. If in the second stage of the fight against the epidemic, like most countries choose to lay flat, with the size of the Chinese population, even if the death rate is 1 in 10,000, there will be as many as hundreds of thousands of people who will die from COVID-19 infection. Although the number of hospital beds per capita in China is comparable to that of developed countries, due to China's environmental and food problems, the prevalence of Chinese people is higher than that of many countries, and the number of beds is still insufficient. When there is no epidemic, it is generally necessary to queue up to go to the hospital to see a doctor. If it is fully liberalized, many hospitals will be paralyzed. Full liberalization means completely lying down, following the herd immunity route of Western countries, and the number of confirmed cases in the early stages of the epidemic will rise in a straight line. At that time, almost every big city in China would be overwhelmed with shortage of medical resources and medical staff. Now that a city in China has an outbreak, it can still get support from other cities. If it is fully liberalized, every city can only save itself. At that time, the hospitals were full of patients, but the sick could not receive timely treatment. If the epidemic control is relaxed, based on the fact that this country has a population of 1.4 billion, about 200,000 people will lose their lives in the next 3 years. This group of people consists of two parts. One part is about 150,000 people, who will die early due to other diseases induced by coronavirus, and 95% of them are elderly people. The other part, about 50,000 people, died because medical resources were heavily occupied and they were not treated in time. It would be very regrettable and sad that people who could have been saved could not be saved. Emotionally, it is unacceptable. If the control is loosened, hundreds of thousands of people will die, and many people will lose their parents or elderly people in their families. These people may accuse the government of dereliction of duty and failure to fulfill its responsibility to protect the lives of the people. If control is not relaxed, tens of millions of people will be unemployed, mortgages will not be repaid on time, many shops and factories will close down, and a series of secondary disasters, and even national turmoil will be triggered. How to handle and coordinate the relationship between the epidemic and the economy has become a very difficult issue for the government. At present, China's epidemic prevention policy is not very clear. At the national level, we hope that there will be no excessive prevention and control, but when it comes to local governments that implement policies, officials in many places can only implement strict prevention and control mechanically in order to keep their positions. Because many officials were dismissed due to improper prevention of the epidemic. As of the end of November 2022, the epidemic has spread to most cities in China, some cities did not detect the epidemic because there was no large-scale nucleic acid testing. It is impossible to fully prevent the epidemic, and the public does not want to continue strict prevention and control. Therefore, it can be speculated that in the future, the government will adopt a relatively loose epidemic prevention policy, and there will be no large-scale lockdown. But some measures will be taken, such as those who are infected will be asked to stay at home. The goal of this is to reduce the spread of the epidemic and ensure sufficient medical resources to treat patients. In the future, China will gradually loosen the epidemic control until it returns to the pre-epidemic state.